It's my pleasure to introduce Dr. Angela McConnell, President and CEO and founder of NOVA Veterans Association. Major Angela H. McConnell, Ph.D., U.S. Army, U.S. Air Force Reserve, retired, has served for over 22 years in the U.S. military, active duty and reserve, in both the enlisted ranks and officer corps. She founded the Northern Virginia Veterans Association, a 501c3, in January of 2015. As president and CEO of this growing nonprofit, she directs the mission to provide comprehensive, personalized services to the underserved veteran population. Dr. McConnell has noticed that women in midlife are often being dismissed and not provided the health care, services, and treatment that they require during perimenopause, during the ages 35 to 60 years old. Symptoms of fatigue, fat gain, muscle loss, cardiovascular, neuromuscular, autoimmune, low libido, lost teeth, gum problems, insomnia, and other issues that I'm sure none of us have ever had to think about ever. And other issues that are overlooked by our doctors. So Dr. Ange, Matt consultant and advocate, is now providing consultation and services to help all of us understand symptoms and work with our healthcare providers to find solutions. So go ahead, Ange, take it up.
Thank you. Wonderful being here at the chamber. I've been a member of the chamber for what, at least 20 years now. So I love the chamber. I want to give a quick shout out to the Northern Virginia Veterans Association because I do work for them, but a lot of this is on behalf of the healthcare situation that we're in right now in America and across the world. But you have in the middle of your tables our gala that's coming up at the Sweeney Barn on Thursday, and it is going to be fabulous. It's going to have a vintage photo shoot with World War II scenes, military scenes for setup. We're going to have 2 female comedians there and entertainers, and it's going to be a wonderful time. A lot of faces that you know will be there. So if you're available on the 30th, register. Registration ends this Saturday, so please register and you use the little QR code there and come on out and see us. Love to have you. It's our 10-year anniversary, so I can't believe we've done around that long, but we have. So thank you for joining me here. This is going to be an interactive presentation. And I labeled it menopause myth busting because there's a lot of misinformation around menopause and perimenopause, and it's literally killing hundreds of women yearly because we don't understand what's going on with our bodies. And it's not our fault because we're not told. Most of us have not been educated and our physicians have not been educated. So I'm here to educate and you're going to hear my story, and then I want to understand your story. And in the end, the idea is to be informed when we go to our doctors, understand ourselves, and make those shared decisions with our doctors from an informed place, not a scared place or a not understanding what's going on place. And this is what I want to ask. What is menopause? Anybody give me a definition of menopause? What?
Menopause.
Say again?
Menstrual pauses.
Yeah, well, it's the definition is, yes, one.
It's a loss of estrogen.
Well, that's a big part of it. So technically, menopause is one day in time. It's 12 months after your last period. So that is the menopause. Perimenopause, sometimes 10, 15 years before that one day in time, you have a loss of estrogen, progesterone, and a lot of times testosterone as well. So a lot of times women don't understand, don't realize that we have testosterone and that depletes. We have more testosterone in our body than estrogen per unit of measure. And that goes away too. So perimenopause, that time before that 1 month, sometimes 10 to 15 years. And another question, because I'm really trying to get the word out about menopause and talking about menopause. You all talk about any of the things that may be going on with you, with your friends or family? Any of it? Yeah. Yeah, commiserate probably. It's like, why? What is going on? I'm having all these hot flashes. I'm tired. I can't think, like all the things, right? And the other big piece of this too is do your partners know? If some of us have husbands and we're not talking to them about what we're going through because maybe we don't understand what's going on, that's really important to learn yourself and then be able to share that with your partner. Because menopause, MHT, anybody know what MHT stands for? Any guesses? Menopause hormone therapy, yeah, otherwise known as menopause husband replacement therapy. So but we don't want that. It's not husband replacement therapy. That's not necessarily the answer. It could be, but not advocating for that. I'm advocating for communication, right, and learning. So 8 billion people in the world, 4 billion are women. We're over half the population. 1.5 billion women right now approximately are in perimenopause or menopause. So that's a lot of us, and we really need to understand. So I did a little research. I did a ton of research over the last 3 years on this subject. I'm going to talk about why. But when I did a PubMed research to find out how much they're looking into menopause and all the things around menopause, there was 10,249 studies compared to 120,000 around pregnancy. And I'm a huge supporter of healthy moms, healthy babies, healthy pregnancies. But you can see the discrepancy in the research is just not being researched. And another fun fact is that most of the research out there is predominantly done on male rodents, male humans, and not on females because we're too complex, right? We have menstrual cycles, we have hormones that go up and down, and they just don't want to throw us into these studies. So predominantly, a lot of the research that we do see doesn't pertain to us because it wasn't done on females for female systems. So menopause myths. Anybody have a myth they want to share about what they think regarding menopause is to them or what it means to them? I'll tell you what it meant to me. I didn't want to admit it. I thought it was like I was old at that point. I was drying up. I wasn't going to be worth anything. I was trying to say, okay, period, come on back. I know you're there. You can go for 6 months, but you're really going to come back. And it didn't. And I just didn't really want to. I didn't want to cross that bridge. I'm like, I'm young. I'm 55. I don't want to be that old person yet. What about defining menopause? Any of you can define menopause or define the symptoms around menopause? Yes.
Have you ever had the grandmother theory?
Yes, I have. The grandmother hypothesis.
We're with one mammal, and there's several others like killer whales, something like that. That actually, like they have that. They're done reproducing so that they can teach the younger generations while the moms are doing the nursing and regulating that sort of thing. And they're there to kind of help that other generation. And so, that's kind of querying around it. And you can actually see it, it's really cute. That live beyond.
Right. So yeah, I have heard of the grandmother hypothesis, and that is widespread. Is menopause natural? How many of us think menopause is natural? Yes, it is natural. It is a natural part of being a human female, being a woman. And we're all going to go through it if we live long enough, God willing, right? But what isn't natural is everything that goes on in our bodies due to the hormone depletion. Women are living much longer than they did even 100 years ago. We're living way past our reproductive years. And during that time frame, from when we stop having periods and being in that reproductive period to death, that could be 30, 40 years, right? If you go through menopause at 50, you might have a good 40 years left. That's almost half your life. So we want to live it strong, happy, healthy, thriving, but that's not happening. Not as much as I'd like. So why do we care? Why do we care about this? What's the leading cause of death in older women? Did you all know cardiovascular event? Heart attack and strokes. Leading cause of death in women, older women. So as soon as we start losing these hormones, these are the death statistics that pop up. Women over 65, cancer. And in there is breast, lung, colon, respiratory disease, lung diseases. Unintentional injuries, accidents, and falls may be due to weak bones and muscles, and diabetes and metabolic diseases. So I want us to think about this. The number one cause is cardiovascular disease. Why is that? Well, the research shows it's due to these hormones in our body. So I'm going to share quickly my story. 3 years ago, I was diagnosed with ALS, Lou Gehrig's disease. Essentially told I had 5 years maybe to live. And I was just blown away. I had a lifetime of being healthy. I started lifting weights when I was 15. I was doing sports my whole life. I was eating pretty good. And then in 2022, I started experiencing all these symptoms. And I didn't know what was going on. And I was having muscle spasms in my appendages, and I was having horrible insomnia and fatigue and exhaustion. And I could go on and on. I'm going to show you the list of symptoms. And I have slides with 20, 30 things on them. And I totally broke the 3-bullet rule on most of my slides because I want you to be able to see this information as well as hear it from me so it sinks in. I was told I was going to die, but I didn't want to accept that diagnosis. So I asked for a second opinion, and thank God I did, because I'm not dying. I don't have ALS. I'm here to tell the story, but there's just a lot of weirdness around why this happened, and why they would even come to that conclusion that I did have ALS. And this is what I'm coming to you all here today to describe these symptoms and these issues. So when you leave here, you'll understand a lot more than you did when you came in here about the symptoms of perimenopause. Menopause is just that one day, right? It's like everything leading up to menopause and then afterwards, and what to be aware of in yourself and what to share with your family, friends, spouses, aunts, sisters, and on and on. So there are different symptoms that you could have during perimenopause. Some of the ones that I didn't have were hot flashes, frozen shoulder, which is very prominent, rheumatoid arthritis, which is an autoimmune condition, and acne and hair loss. These are the ones I did have. Yeah, not exaggerating. So about 15 years ago, I started having cardiac heart palpitations, just like beating out of control. Wake me up, middle of the night. I went and got a full workup, the stress test, the functional MRI. Nothing was wrong with me. I'm like, something is wrong with me. What could be causing this? That was probably my number one indicator. And this is actually researched and proven now that this is a perimenopause symptom due to not just the drop in hormones, but the crazy fluctuations that your body go through. Is like, am I dropping an egg or am I not dropping an egg? Am I fertilizing an egg or am I not fertilizing an egg? And it's like all of these ups and downs and surges of estrogen, progesterone, LH, LSH, all the hormones that our body usually just has a normal, smooth cycle to, is just going crazy up, down, sideways. So that's what our bodies are going through. This was about 40 years old. I'm 57 now, and this was 3 years ago. So high blood pressure. Over the years, like 5 years leading up to my diagnosis of ALS, my blood pressure started going up. Why? Well, it's my blood pressure going up and my cholesterol. I'm not changing anything. And I always thought, white coat syndrome, I'm running into my doctor's office. I'm not slowing down. I just need to breathe. And that got worse and worse and worse. And what I didn't realize at the time is that estrogen is protective in the body and it's anti-inflammatory. And as that was diminishing and dropping off almost down to zero by the time I learned all of this a couple of years ago, my blood pressure was going up, and inside my vessels, my arteries specifically, the tissue inside of them was building up. So in my renal arteries, which connect to my kidneys, it was getting constricted, which causes your blood pressure to skyrocket like 200 over 100. I mean, it was crazy high. And I'm like, this isn't right. And the doctors were like, oh, just take a bunch of blood pressure medicines. I'm like, I really want to know what's going on because I don't think I have plaques in my arteries. And I didn't. I had something called fibromuscular dysplasia. And if you want to hear, like, I'm just giving you the whirlwind right now, but on the page in front of you, there's a QR code to the YouTube where I really get into depth in all of these. And then I do deep dives into all of these different subject matters going forward. So all the information will be there. So high blood pressure, everything was drying out. My eyes were drying out. My skin was drying out. My vagina was drying out. Everything was drying out. And I was miserable. And so that dryness was coming about. Didn't really think about it. And I'm not going to go through all of these because you can read through them. I think some of the biggest thing was a brain fog. I couldn't think. I'm used to running multiple businesses. I was running the Northern Virginia Veterans Association. I was consulting. I was an adjunct professor at GW, teaching integrative medicine. And I was doing all of these things just no problem. And all of a sudden, I couldn't add. I was playing dominoes with my granddaughters and I couldn't add 2 and 8. And I'm like, what's going on with my mind? I couldn't do my grant budget sheets. So my brain really started to fail me. And I think that was the largest impact because I thought in 2023 I was going to have to step back. And I did from George Washington and some consulting. I'm back now with consulting and I still have no veterans. So all of that is fabulous. But I think the brain fog was the worst out of all of it, even with the pain and the muscle spasms and everything else I was experiencing. So why do we have this? Any ideas on why we have potentially a lot of these symptoms and health conditions? Literally every organ system in my body was affected, from my brain to my skin to my joints to my stomach, bladder, kidneys, like everything. Yes.
Since our bodies based, so when your hormones are out of balance, every other function gets going.
Exactly. So we have these estrogen and progesterone and testosterone receptors on every organ system throughout our entire body, everywhere. And when we stop producing these receptors shut down. And so the downstream effects of these receptors shutting down are these symptoms, the hot flashes, the dryness, the joint pain, because they're protective. They have these anti-inflammatory effects. So when these receptors shut down and we're not giving them the hormones, all of these things come about. And that's why our cardiovascular risk goes up, our cancer risk goes up.
In truth, by 16, it's having like shutting down heart. How did you not make for having heart attack?
Because well, I had some issues on my left side and they just got exacerbated, and it was like a numbness and a tingling going down my left neck and arm down this way. Women usually present differently than men with heart attacks, and that's one of the reasons that a lot of women don't recognize that they may be having a cardiac event. Men usually, it's like you said, it's like on the left side and they're holding their arm. Women, it could just be like super exhaustion and they just got to lay down. And they just don't feel like they can't get back up. It presents sometimes totally differently, but yeah, no, it's a good question. Yeah, had weird rashes too, just all kinds of stuff. So the idea behind showing you this is if there's something going on, you need to pay attention. I started as a researcher, I started tracking and logging all of this stuff. I logged all my labs because the doctors were doing, not collaboratively. I mean, I was going to like 21 different specialists. 95% of them thought hormone deficiency was not the cause. And I asked them, like, hey, I'm right there at menopause. Could that have anything to do with my brain issues, with my neuromuscular issues, with my joint problems, with this autoimmune condition, which I never had before? They're like, oh, no, that has no bearing. I'm going back to all those specialists now with my data and the research to back it up. So 22, I probably didn't get all of them. I was seeing in 2022, 23, 24, and some this year as well, over 22 different specialists for different reasons. And I was on a mission. Why do you think I had to go to 22 different specialists?
Because your endocrinologist was your last one.
The endocrinologist was the last one. However, what they do is when you have a heart problem, they send you to a cardiologist. If you have a urinary tract infection or issues like that, it's primary care, your OBGYN. If you have urinary issues or kidney issues, it's a urologist. So they send you to the specialist they think help you, when if they just would have taken a step back and said, oh, yeah, you've lost all these hormones. Let's look at your estrogen, your estradiol specifically, your progesterone, your testosterone, your luteinizing hormone, FSH, and see where you are. And if they would have done that in 2023 when I was diagnosed, then I would have immediately said, okay, how do we replace these hormones? And then we would have had those discussions about hormone replacement. And that didn't happen until 2 years later. But they were literally sending me to all these specialists instead of looking at me like my primary care or even my OBGYN. Though, can we agree that the OBGYN is not a master of all these areas? It just is, they're not just sex hormones or hormones that affect every part of your body.
But if you know that you might be going through this, that you suffer from these symptoms, and you kind of have an idea. And you tell your doctor that you want to be more strength, but they don't understand.
Yes, that happens more times, probably more times than less time. I would say 90% of the time when we go in to ask our doctors to please check our hormones, if we're not in menopause already, they'll be like, oh, the hormones are fluctuating. We won't get, a straight answer because we don't know where you are in your cycle, which is true, but there is some validity to getting your hormones checked just to have an idea. And that's something I'm getting into. And this is why I'm doing this, because 3 years later, I realized that my girlfriends are calling me with these issues. And I'm like, well, have you done these labs? Have you talked to your doctor about this? Are you considering, these types of options? And they're like, no, I had no idea. So I started consulting my girlfriends and giving them all the information. And the more I did that, the more I talked with other women and just realized this information is not out there. And so this is what I'm doing now. A big chunk of my consulting, I would say every part of my healthcare consulting is focused on women in midlife because the support is not there. I was told I had a DEXA scan. Everybody know what a DEXA scan is? It's a bone density X-ray. So it's a low radiation X-ray that shows you how much density you have of your bones. Normally, you don't get it until sometimes your insurance may cover you when you're 60. Mine did it when I went through menopause. They're like, oh, 55 menopause, let's do a DEXA. I came back with osteoporosis. Had no idea. It's like, there's no way. And I got another one because that's just how stubborn I am. It's like, it can't be like with the ALS, didn't believe it. And I did. I had osteoporosis in two of the four bones that they measured. And I was just dumbfounded. So when you have thin bone density, what that tells you is that later on in life, you're prone potentially to a fracture. And if a woman fractures her hip, she has a 50% of dying in the next year. And that is a statistic. So we're really concerned about our bones. And this is something we don't know unless we get a DEXA, right? Or break a bone. And then you go in and get a DEXA. Yes.
On the purge and the death freeze after the hip break.
Because they have to go in the hospital. They're immobilized. If they're already in poor health to begin with, they're more prone to infections at the hospital, not recovering well, not being able to get up and get mobile afterwards. There's many, it's kind of multifactorial is why that happens, but that is the statistic out there. So unfortunately. And so, yeah, so osteoporosis, I will say that I did get on hormone therapy and the right kind of hormone therapy I feel for me now. And in 1 year, through lifestyle changes, I forced myself to get back in the gym, even when I was tired, and probably did some things that weren't the best, because you have to let yourself recover, right? You have to give yourself that time. I reversed the osteoporosis. So now I'm up a level, it's called osteopenia. And then in one of my bone areas is perfectly healthy. So you can reverse it once you get it, which I didn't know that either. I was like, oh, great, I'm gonna break a hip in a year. So I didn't know what was going on. I was like researching into all of these things, just super deep dives. So I would urge every woman to, and we'll talk about this if you feel free to, contact me later, but I urge every woman to get a DEXA scan. Just find out what your baseline is, if nothing else. So if and even if you don't do that or don't want to do that, you need to do load bearing exercises. And we'll talk about what those are and what that means. You got to put some impact on your bones so they'll break down and build up. It's a cycle. We want to keep those bones strong. So every organ in your system, cardiovascular, your heart, your vessels, like I talked about, my renal vessels, your brain. I had scattered white patches in my brain, and they're like, oh, maybe that was from migraines way early on and different things. And maybe it was, or maybe it was because some of my neurons were dying in my brain. Gastrointestinal, literally from your mouth all the way down to your butt, gets affected. Your microbiome changes, and that gets affected. It can cause constipation and a lot of other junk that you don't want to have going on in your body. Lungs, skin, eyes, my vision was decreasing at a rapid rate. I mean, I think at some point, okay, I need the readers. I got that. I'm kind of okay with having the readers at some point, but my long distance vision started going away, and that decelerated quickly. And I was getting a new prescription like every 6 months. And my eyes were dried out, all kinds of drops and gels and everything to keep my eyes from being dried out and seeing flashes and stuff. So that was crazy for me too. Again, the bones, the muscle, connective tissue, the fascia that holds our bones. The fascia is all over your body. It's like a connective tissue all over your body and holds your muscles to your bones, and it's connected from your head down to your feet. That was just in tight knots. So I was seeing a myofascial therapist paying for it out of my own pocket, totally worth it because I knew what I needed at the time. And I was spending money on, extra therapists. I was throwing money on extra supplements. I was throwing money at an integrative medicine doctor, boarded in functional medicine, just, I mean, I was not going to die lying down. It was just like, I'm gonna figure this out. And I did. I will say 80% of my issues and symptoms are now gone 2 years later. So there is hope for all of us. I want to give a little bit of information about the women veterans. I am one. How many veterans do we have in the room? I know I saw some. Well, so women veterans, these issues a lot of times are exacerbated in this woman veteran population. Because speaking as a woman that was in the army back in the mid-80s and forward, there are gender differences and there are equity issues with regards to getting healthcare, getting listened to seriously, getting treated appropriately. And once you're dismissed and pushed to the sidelines, especially with a young woman veteran, many times you don't go back and try to seek services. So that was one of the issues for women in the military. Cultural barriers, just the stigma. You know, you don't want to go in if you're having really bad periods or cramps or questions about what's going on, because it was, especially back then, it was a men's army. It was. And, you know, I didn't want to complain. I mean, I would do the physical fitness test and they're like, okay, you maxed it for a woman at 18. I'm like, yeah, but what's the man's max? It's like, you always as a woman, you had to be better than the guy next to you if you were going to be recognized and promoted. And that was reality. But when it comes to healthcare and getting seen and getting support for these symptoms, there's issues that go on in the military and outside the military, but specifically sexual trauma in the military, MST, sexual trauma and other trauma. And those issues can exacerbate these symptoms down the road. So I say that about the military because I know statistically women in the military versus civilian women suffer more of these things, but it can pertain to any one of us. I'm coming back to this slide, the leading causes of death in older women. How much of this do you think is preventable with regards to, let's say, cardiovascular disease? I want to say one in 50 women will have a cardiovascular event before the age of 60. Don't quote me on that, but I think I remember that correctly. And this is, again, after the age of 50, going forward. How many of us think potentially at this point in the conversation that maybe what causes cardiovascular disease? Let's back up a little. What causes a heart attack or a stroke?
Fitness in the back.
Yeah, just a plaque in the vessels and the arteries. Sometimes will clog those vessels and cause a stroke or a heart attack. What was another thing? Lack of fitness?
Fitness and diet.
Fitness
In your diet.
Fitness and diet, fitness and nutrition. So, you know, eat a lot of those high cholesterol foods. Do you all know that cholesterol is the beginning process for your hormones? Your hormones come from cholesterol. We need cholesterol in our body. We just don't need an overabundance of it. And that's when nutrition and diet comes into play. We have to have cholesterol. And when women go in and they have high cholesterol around this age, around, I'll say like 40s, 50s, if it starts creeping up, that's normal because your cholesterol is going up and up and up, trying to make more of these hormones that we're losing. So it's naturally going to go up, trying to replenish these hormones. So it's not necessarily you're eating that. I wasn't eating any differently. And my cholesterol was going up. It's going back down now. And I'm like, that just doesn't make sense to me. So again, the cholesterol going up, and then they want to throw statins at you. They want to stop the production of cholesterol. But that may not be the answer. And I would say, always ask your doctor, is there something more natural? Can I do something lifestyle? Try to get other options unless you're just, I mean, of course, listen to your doctors, but ask the questions and advocate for yourself. So how do we help ourselves? This kind of gets back to what you were talking about earlier with regards to you go to your doctor and they don't want to run a hormone test. They don't maybe want to talk to you about getting on hormones. I will say I saw 22 plus specialists. I'm still seeing a few of those now. And I had one literally walk out of the that was asking about hormone therapy. And he was just like, I don't talk about that, you know, it just made him feel very uncomfortable to even talk about it. When I went to my GYN, I finally found a GYN that the VA referred me outside of the VA to see like a GYN that provided hormone therapy. I talked to her about like low libido, my bone health, and some of the other symptoms I was having. And she's like, well, we only treat hot flashes and insomnia, and there was like something else, none of which I was really having. However, I was having it enough to be able to get on the hormone therapy, and I did. And I said, well, what about testosterone for low libido? Because it is authorized by the FDA to get testosterone for low libido, but it's also fabulous for your bone health too. And I knew that. And she's like, oh no, I don't deal with testosterone. There's no research. I'm like, yeah, it's literally authorized by the FDA as a secondary treatment after the biphosphonates, like reclass from other ones. And I'll digress and tell you a little bit about biphosphonates. So if you lose bone, and you have osteopenia or osteoporosis, your bone density is low, usually the doctors want to get you on a biphosphanate, which stops the breakdown of your bones. So your bones build up. But within 5 to 10 years, you could be at greater risk for a brittle fracture of the hip from being on these, because your bones cycle all the time. It breaks down and then it builds up. And that's just your normal cycle. And it's stopping one part of the cycle and stopping the breakdown. So your bones are building up, but then they get brittle. So again, I went back and say, I want to be on a low testosterone. Can we do that? She's like, no, don't, you know, I don't know anything about testosterone. I'm not going to do it. I did find an endocrinologist within the VA that did prescribe me testosterone, which they do not have a dose for females. So they literally give me a little package and say, it looks like a little ketchup package of testosterone gel. And they say, take 1/10 of that every day and put it on your leg or behind your knee or someplace, and that's your dose of testosterone. They're like, you figure it out. But when I was talking to my endocrinologist, he was like, oh no, I can't do that. And then I brought out the research. I'm like, well, why not? I said, if a man came into you with low libido, which is what I was talking about, and you know, fatigue and other issues that I was having, I said, what would you do? You would test their testosterone, you would put them on testosterone, probably Viagra. And I said, and you won't do the same thing for males? I mean, where's the equity in that? And he was like, okay. So I convinced him, thank goodness. And he put it in, and the pharmacist wouldn't fill it at the VA. And they're like, no, it's for a female, we can't fill it. And he had to argue with the pharmacist. And finally, the pharmacist agreed. So it's like you can see the uphill battles that we're facing across the board of having to educate our providers and advocate for ourselves and educate ourselves. So the first thing is be aware of yourself. Get some kind of a tracking journal log and just start noting your symptoms. Like if you start having something, just note it and note if something makes it worse or better. Like, okay, I'm feeling bad. Maybe you're having a hot flash. I never really had those too badly, but maybe you're having a hot flash, and you notice if you drink a glass of wine, you know, it just goes out the roof. You're taking off jackets and layers and trying to get cooled off. If you're walking outside and your knees hurt, or if you're maybe eating a lot of gluten or dairy and something goes, you know, haywire in your body, just try to track all of your symptoms. And I have a big symptom checker on my Facebook and on my YouTube. I'm going to have these free resources for you. I'm going to have a lot of free stuff out there. So you can prepare this before you go to your doctor, so you'll have the information on yourself. First, you need to know your medical labs and scans that you've had, broken bones in the past, hysterectomies. A lot of times if a woman has a hysterectomy, they don't want to put you on progesterone because progesterone opposes the estradiol, the estrogen. So they're like, well, you don't have a uterus, so you don't need that. But progesterone is great for so many of the other organs in your body, and it helps you sleep fabulously. So having 100 milligrams of progesterone at night is not necessarily a bad thing for many of us, but the doctors don't know that. They're going off of very old research from 2002 called the Women's Health Initiative. And when that came out and was published, and I'll say right now, all the research I do, I tell AI to exclude anything from the Women's Health Initiative, because the study was flawed and skewed, and the media got the first information about it and said, oh, hormones cause breast cancer, and heart attacks. And that went out, and it scared women and it scared the doctors for 20 years. And I've heard like one of my favorite podcasters, urologist Kelly Casperson says the boomers should be pissed because for 20 years doctors wouldn't even talk to you. They're still not really talking to you, and they're suffering. I'm looking at my mom who's 80, and all these symptoms I have, she's suffering from now. And it's so unnecessary. I mean, if your thyroid gets messed up and it stops producing, then you're going to get on thyroxine, right?
Lots of guys.
Yes, to replenish it. And so why shouldn't we at least have the option of having a discussion around estrogen, progesterone, and testosterone? It just doesn't make sense. And honestly, it's not fair for women not to be able to have these options. So my job is to educate and let you know that you do have options. And my goal is to help you talk with your physicians, whether that's primary care, an endocrinologist, or a GYN, and have those conversations and hopefully get them to have the latest research and information so they can make an educated decision with you. It's called shared decision making, not they dismiss you and not listen to all of these things that are going on. So track your system, your symptoms, track your labs, and have all that ready to go in. And I'll have a cheat sheet form. I'm creating it now where you can fill it out and just have everything in front of you, because I know so many times I'll go into a doctor with something I want to say and totally forget. They'll get on their roll, they'll do their thing, and by the end of the appointment, they're walking out the door. I mean, it's 10 minutes, right? So it's like, how do you get these things across in 10 minutes? Write it down, be prepared.
So you're saying that all these even after you stop and get the menopause, you'll get that forever afterwards, or would they regulate them?
The only symptom that I understand now, where research is currently being done over the last 5 years on women's brain and depletion of hormones, is your brain and your thinking may start to regulate out, but it won't be performing at the potential that it was performing prior to. But it won't be like total brain fog. That's the only research. All the other stuff, you lose 30% of your bone in the first 5 years after menopause. 30% of your bone, women do. Men start losing it like in their 60s, 65s, but at a much slower rate. But women, it's precipitous. And that's why we're having broken bones and hip fractures and osteoporosis. Yes.
I like looking at blogs, looking at the side of all the symptoms, and I am a little younger, not quite a menopause stage, but like, would you recommend going to like a discussion list about these symptoms? Like, I'm looking at these and I might have them for hormone.
You may, and I would strongly recommend finding someone. Again, I have resources on other physicians that are specialists in these areas. If you don't have a physician that isn't informed and educated, there are some out there that are certified in menopause and hormone therapy, and that would know how to talk to you, because just because you haven't hit 35 or 40 doesn't necessarily mean that you may be having issues. When I was very young, I was into a lot of sports and I would not have a period for a year. And I thought that was great, and lo and behold, I find out later that probably my hormones were super low. It's called amenorrhea. You should stop producing those hormones, and it was affecting my bones and my muscles and everything else. And I had no idea. So yeah, if you have concerns, I mean, maybe it doesn't have anything to do with hormones, but you won't know until you go and have these conversations. And please learn from me. Don't wait until you're diagnosed with ALS or MS or some other horrible condition, because all of these things came about and just hit you like a hammer. Yeah.
You were talking about testosterone, and Dr. Thomas Friday, all of that. What is very common right now, versus men's health, everybody helps for testosterone. And then of course there's compound where they can do dosing, with specific individualized dosing. So what's going on in that area?
Yeah, so this is one of the big things I talk about, like on my YouTube. I think I have a 2-minute video where I say, please do your due diligence, do your research before you listen to an influencer on YouTube or you talk to someone like at a med spa injecting pellets and other hormones, because some things are just not safe. When you have a pellet with the testosterone in it injected, you can't get it out. So if you have, horrible symptoms from it, it's stuck there unless you want to get it surgically removed, which some women have. I would say that would be the last thing I would do is pellet testosterone therapy, and that would be after I had been on it for a couple of years, maybe in some other lower dose forms. Like I'm just doing a little bit of gel. I'm not doing injections. I'm definitely not doing the pellets. And med spas aren't really, in my opinion, my professional opinion, they're just not really in that space. They're a medical spa. They're not a doctor. So they're not necessarily educated. They're giving women what they want because we don't have the right information. Yes.
Can you talk about the role of stress and social connection and how that plays into our hormonal issues?
Yes, absolutely. So stress and so stress management was one of the key things for me, because once I started learning about all of these issues that I had, and I was feeling horrible and I was having so much pain and so much exhaustion. I had so many requirements. I was still running Nova Veterans. I was still writing grants. I still had kids. I had to learn how to stress management. Luckily, my background for the last 25 years has been in integrative and whole person health. So I knew all the things. I knew meditation and relaxation techniques and different types of massage and therapies. And so I fell back on all of those and that community. So I was very lucky in that respect, but you have to take care of yourself. You have to stop, you have to slow down and give that to you. And social connection, yeah, the community, you need to find your tribe. You need to find those girlfriends and guy friends and people that you can talk to and stay around, because if your whole life is your job and those are the only people you know, and then you retire and you don't have anything else, then you're alone. And isolationism and depression and death comes early.
And can you also talk about the importance of hydration through yourself?
Yeah, that was like one of the number one things that was going on with me. I think I had it listed as number 2 was dehydration of your cells. So people say, drink water, drink water. One of the things I learned is, yes, we do need water in our system. We do have to replenish, but you need a little bit of sodium, like a little bit of salt, nothing artificial, but you do need a little bit of salt and maybe a little bit of sugar to be able to have your cells absorb that water. Otherwise, you're drinking a lot of plain water. And if you don't have that either through food or in your water, then you just kind of flushing it right out. So dehydration is huge. If you'll notice it in your skin, and it's not necessarily a topical problem, it's an internal problem that you have to look at. There are some supplements that people get on, and again, there's so many things I tried, and some things worked really great, some things didn't. And being in the integrated medicine field for so long, I just had a lot of great support in that area. But yes, extremely important. So educate yourself, risk versus benefit. So you may go in and say, I want to be on possibly some hormones, and they're like, oh, you can't, you have high cholesterol and your mom had a heart attack. You have to look at the risk versus benefits. Nothing that happened with your family, except for maybe some cancers, impact you as an individual outside of your family. So yes, maybe there may be some risk there, very mild maybe, but what's the benefit? I mean, my muscles were literally deteriorating. It's called sarcopenia. It's when your muscles start to degrade, atrophy. And I used to be a power lifter. I mean, I was competitive and I was watching my body fall apart, the muscles, the bones. So know your body and understand the risk versus benefit. And I'm not saying hormones are for everybody, but we need to be educated on what they could do for us and what may be right for us. And again, non-hormone therapies. We got to get good sleep. Have to. That's when you recover. That's when your brain recovers. and your lymphatic system in your head recovers and kind of washes everything clean. You need to have at least 7 hours of good sleep, not getting up 3 or 4 times to pee. That is a thing. So we need good sleep. We need proper nutrition. Women need approximately 1 gram of protein per pound of body weight, ideal body weight. Let's say you're 150, but you want to be 140. That's 140 grams of protein a day. That's a lot of protein. And we're not getting enough. And our muscles are breaking down because of it, and our bones are breaking down. So we really have to look at, they call them macros, our protein, our fats, our carbohydrates, and our fiber. So all of those things are extremely important. Social support, right up there, yeah, and stress management. So this is one of the things that I help my clients with. I help them prepare for their doctor's visits, but you don't need me. You can do this yourself. And you can do this through the tools and some of the things that we're discussing now. Bring home that 1-pager, and that will give you a good start on where to find these things. So ask for an appointment outside of your regular 10-minute appointment. Say, I want an appointment to talk about hormone therapy, perimenopause, menopause. Let them know ahead of time what you want to talk about. Bring that list of symptoms, dates, and how they impact your life. Not just like, oh, I have insomnia and I have hot flashes and my joints hurt sometimes. You really need to give them details. Like, I can't walk well anymore. I've been tripping. I have hot flashes are keeping me up. I'm not sleeping well. You really have to give all the details when you go in so they understand. And then have your goals. What do you want from that appointment? Do you want to potentially get on hormones? You need to have these things figured out and written down when you go in there, and then have the research and the guidelines for that doctor. So if you're seeing an endocrinologist, that information that you give them may look different than if you're seeing your GYN or your primary care. So you want to be prepared. You want to have this information, and don't let them dismiss you. And if they do dismiss you and say, oh, I'm not going to talk to you, and I will maybe warn you a little bit up front, they may dismiss you. They may not want to talk, and it's because they don't know. So many doctors, most of them are not educated in this. They're thinking of Women Health Initiative study from 2002, where they believe that, if you're on hormones, you're going to have a heart attack and get breast cancer. And that is absolutely not the case. That information was skewed. It was done on women average age of 62, most of them smokers with already having morbid conditions like cardiac issues and higher cancers. So the information was skewed, and they were also using different types of hormones. We're using bioidentical hormones, so that's one thing you want to make sure you ask for. Bioidentical, it is identical to the same things that we produce naturally. What they used in the Women Health Initiative was synthetic. It was conjugated equine estrogen from horse urine and synthetic progesterone. And both of which we don't use these days. So again, that's what our doctors know, and that's what we have to educate them on in a nice way. And I've been educating doctors for years. I did my dissertation on how to talk with doctors and have them understand to look at their patients in a holistic way and remove biases that they may not even know they have when a patient walks in the room and the patient's heavier, or they don't look like themselves, or whatever it might be. When the doctor sees the patient, there are biases, and we want to see a patient holistically. And that's one of the things I've always loved about integrative whole person care, because you're just not one organ system, you're a whole person, whole human being, whole woman. And that's how doctors should view us. Yes.
I'm going through all of this, but
I'm sorry. Yeah, it's
I'm gonna be 60, and I'm just like, what happened? So,
yeah.
so what do you think of bioactive peptides?
Bioactive peptides. I don't have a lot of information on bioactive peptides. Peptides are proteins. A lot of those are injectables.
What about that are those capsules?
Are you talking about the GLP peptides or the other, like the BCP57?
Exactly.
Yeah, those have been recently taken off the market by the FDA. So, but I did hear they had some great anti-inflammatory effects and muscle building impacts, but I can't speak a lot to that because I don't know a whole lot. Yes.
To the most frustrating thing, it's gonna go down rapidly. But that's like when you go to your gynecologist with whatever doc, and they don't have that education, and you can go to mini health, or you can go to a medical, like women's health specialist, that stuff's not covered by insurance.
Right, right.
But you can go to your gynecologist, yes, that's covered by insurance, but they're not gonna treat you, or they're gonna say, I don't know, or they're gonna, dismiss you for all the things you already mentioned. I don't know if you know where we are with this whole women's health and covering these issues.
Yeah, there's a huge movement. In fact, I was talking with you earlier. I'm going to Orlando next month to have conversations with other thought leaders in this space about what we need to do to change the policy, the guidelines. The FDA has black box warning on vaginal cream, which is a local cream you use for your vagina. It's like the best thing to cure, to prevent UTIs, plus so many other wonderful things for your lady parts. And there's a black box warning saying it may cause stroke and cardiovascular incidences and these things which are absolutely not true. And so that's like one of the first steps is getting these unnecessary, not true black box warnings off of something as vitally, wonderful as vaginal cream that I think everybody should be on it, even women with breast cancer or had breast cancer is safe for them to use, and that's shown in the research too. So that's one of the things is us getting together, us women getting together, and pay attention. If you're on Facebook, I'm putting all of this out about the recent legislations and movements and petitions and things that we need to do as a community, men and women. Both of us, like we're all in here together. So I really urge you to just try to stay on top of it with us. Yes.
If you send me this, I'll share.
Okay.
Go along with just the council too, and whatever else.
Absolutely.
Relates to whatever you hear.
Yeah, absolutely. And my goal for all of women and all of us and our families is to be able to offer personalized assessments based on current FDA guidance, best practices, and your choices. That's the key. What you want to do for yourself, your body, your life, and then to provide specific guidance for your provider based on what provider you're seeing. So you can have that shared decision making. If you don't get that shared decision making, then we go on to plan B. My goal is to educate the provider so we can work together. I've done that, the last 25 years is educating providers in different areas. Yes, they are educated, they're specialists, they're smart, but they just may not know about this. And how can we introduce it without us patient explaining to them, which is a term that I just made up, and have them not get offended or just say, I know my job, you don't know my job. What is it, Dr. Google? What did you just look that up?
Google MD.
Yeah, Google MD. It's like, I know this, you don't know this. So it's easy for them to get on the defensive really quick. I've noticed that over the years, these past 3 years specifically. So I want to facilitate patient and shared decision making. And the other piece of that I've noticed is in the workforce. I almost quit Nova Veterans in 2023. I had my succession plan. I was ready to step down. I could not do it physically, emotionally any longer. And I eventually, once I realized all I needed was a little bit of hormone, and things started to reverse. I mean, yeah, it took me a good year. I've been on hormones since about 1.5 years now. So it's taken a while, but I'm back. So, and I'm happy. And this is because I'm feeling so good. This is my focus now on integrative medicine. It's with women for this cause. And I also want to reach out to businesses and corporations so they can update their HR policies, have flexible work schedules, understand the importance of women in midlife who have all this experience, education, expertise, and they want to keep us. They don't want us to quit, and they don't want to get rid of us because we're having a bad day or two, or we're having all these things we're trying to figure out. So what I want to do is bring ideas, policy updates, things that they can do to support women in midlife. And corporations and businesses need to understand this as well. So that's just kind of a side piece, and because we're at the chamber, I wanted to bring that up. So we are extraordinary company assets. And I'm happy to say that I am back. This is the top left there is Jiffy Lube Live. A couple months ago, I loved a bike ride, both automotive and non, and just loving my life. I couldn't do any of these things. I didn't have the energy to watch TV. I mean, I would get up, I'd have maybe a couple good hours to get things done, and then I was just down and answering stuff on my phone. So it just really, it knocked me out. I mean, if anybody's feeling these things now, I urge you to get checked out, follow some of these guidelines, if not all of these guidelines, and I'll have a lot of free resources, tools, checklists that you can get. This is my YouTube QR code, is also on this sheet here. And you can email me at drangemack.com. On the back there, I also have these. And this is, if you want more information, if you feel like you have a complicated case, or you know someone who needs more individual and they don't want to try to do this maybe or figure it all out on their own, because when you have crazy labs and you have crazy medications that you're on and all kinds of things, I'm here to help with some of those. So you can grab one of these from the back or here if you want and reach me that way. And I'm, again, happy to help. Any other questions? I know, whew, that was a whirlwind. Yes.
So what blood tests are we asking for to test the hormones? Like, what do we tell our doctor?
So it's a combination. So usually it's estrogen, progesterone, testosterone, free testosterone, sexual binding hormone, LSH and LH, and they're and just kind of depending on you and some other things without knowing your labs. Again, I'm not an MD, I'm a PhD. I don't give medical guidance, but I can definitely review those things and tell you the standard practices for the lab work that you're asking. Also need to know some things like, are you in menopause or perimenopause and symptoms? And we would do deep dives into every individual. I look at everything. Everything. Any other questions?
I have a question.
Yes,
So,
Michael.
you're a significant helper,
Yes.
like, how has he adapted, or how kind of support, like himself,
Okay. Yeah. So he was asking my significant other,
Be a good listener.
Craig. So it was really hard. I will say that it was really hard on him. We are newlyweds. We've been married about a year and a half. I found out in January 2023 when we were just dating that I supposedly had ALF. I didn't tell anyone. I couldn't tell him. I couldn't tell my family, my boys. I was just like, I lived with it for months trying to figure out what my next steps were because I was just so scared. It's like I thought I was going to marry this guy and now I'm dying. I don't want to give that to him. That's not a good wedding present. So no, he's been fabulous. It did kind of floor him, obviously, because I didn't figure out till much later on, probably about 8 months, I started seeing physicians at UVA down in Charlottesville, and that's an academic medical center that specializes in fibromuscular dysplasia, which is that issue with the buildup of tissues inside the vessels. So I got the VA to let me see all my primary specialists at UVA in Charlottesville, and it wasn't till many neuromuscular appointments later and EMG testings and nerve conduction testing and all those painful things that they said you don't have ALS. So, and they still don't know exactly what's going on, but I swear to you, it's low hormones because all of these issues are resolving slowly. But yes.
Somebody hasn't. They make it.
Oh yeah, I do that. I do that as well.
Doing things, that's probably just getting infected, but. But,
It's good to
Also,
need to
we
know
were talking
these
about-
things.
yeah.
Mhm.
They would be able to.
Mary Claire Haber.
Haber.
She'll be at the
It's
conference
like-
next month. I know.
What is her, but she's a great person. I think you would probably agree. She's a great person.
Yeah, really good.
She is a gynecologist, even, she has, like, her blogs are kind of straight to the point and short.
Mhm.
So she's a great person.
Yeah, Mary Claire Haber, Vonda Wright, orthopedic surgeon, and clinical researcher as well. Kelly Casperson is a urologist. These are all forward-leaning women in this space, helping women like us and helping the movement. I think they call them the menopause. So, yeah, cute, love it. And we're gonna have some really good conversations in Orlando. I've done a lot of policy development and making over the years, so I know I can bring that piece to the table. I've done it with veterans. I'm on the Joint Leadership Council, which is a governor-appointed council for veterans that shape legislations for veterans and veteran women. So I really want to help move the needle as quickly as possible. And again, we can only do this if we're sharing. Share my information with the women that you know and love, or even the ones you don't love, because nobody needs to suffer. We don't need suffering. It's not natural. Menopause is natural. Perimenopause is natural, but the suffering is not necessary. And that's what we're all doing. And if I would have known 10, 15 years ago when I was having heart palpitation that my progesterone was low, then I could have easily gone and had that conversation, but I had no idea until 2 years ago, all this was going on. Yes.
It's just, I guess last question, a few questions. Sorry.
I'm just curious if culture, ethnicity impact how menopause presents in women.
Yeah, there's definitely a disparity there. Black and Hispanic women experience worse symptoms with regards to hot flashes and night sweats and insomnia. Those are big ones that I'm aware of, but there are more. I just haven't done a ton of research. And that's one of the things that I noticed with some of these conferences that I went to in the past, that those other ethnicities and races weren't as well representative. And I'm really curious when I go to Orlando, it's like, is it going to be a lot of white women? Because that's all I'm seeing in this space. Or are we going to have a mix of people? Because, you know, all of our doctors and all of us need to understand this and know how it impacts us. Because, you know, if you're having these hot flashes and night sweats and these surges in hormones, because what happens is your brain is not getting the estrogen. You have estrogen receptors in your neurons, so it's sending signals, and then your temperatures are going crazy, and you're having hot flashes and mood swings, and you don't know what's going on. Your partner doesn't know what's going on, and you don't know how to act and react. So yes, there are disparities between different races. I don't have all the research on that yet, and boy, do I research. I have been doing nothing but research in the last 3 years, out of thousands of journal articles, hundreds of books at this point, and I just this is my lane right now until it gets to where we're all taken care of equally and offered the same treatments and options as our male counterparts in so many areas. And this is my soapbox, and I'm happy to help any of you all there, men or women that have questions. Please feel free to reach out. Yes.
Can you discuss the role of over caffeinated? Too much caffeine in your adrenals and your.
Yeah, over caffeination. So caffeine, I've heard both sides of that. You definitely over caffeinate yourself and have too much caffeine. People probably know that. They will get the jitters, or they'll have a cup of coffee at 10 and they won't fall asleep till 2 a.m. the next morning, right? Because it affects them so much. You may notice that you react differently to things like caffeine as you get older and start going through some of these hormonal changes. I would say alcohol really hit me hard. I would enjoy a couple of glasses of wine, every few days, every other day or so. And that was just like dinner. And it got to the point where I couldn't metabolize it. I would wake up not just with a headache and not sleep well. I would have an emotional hangover. I would be depressed. I would be sad. And I'm like, where is this coming from? And it's the alcohol, and alcohol is a toxin. So, I mean, I think that the younger generations, like 20s, they're all into the mocktails now, and they're so many of them are non-alcoholic in the colleges and coming up through the years. And I've realized that, yeah, I do like a drink, but if I have a drink, I know I'm going to pay the price. So, and sometimes I do, but then I'm like, the next day it's like, I do that. I'm like, it does taste good, but I'm putting mocktails, ginger beer, lime juice, mint, they taste just as good. And do I really like the taste of alcohol? Yeah, I like a red wine. Okay, I admit, but it's not necessary, and I know it's hurting me. So I want to love the foods and drinks that love me back. All right. So you guys know where to reach me. Feel free to pick up cards or my business cards in the back, and take the one pager with you or screenshot it before you go, and I'm just here for you.
Thank you very much, Angela, and I'll share whatever is most years at the act to our full Joint Leadership Council. I just want to make a few announcements in the chamber. Next week is our Suit to Armed Forces. On 11/6, right next door, or 6, we have a true bike business after hours. November 18th, we have Dumfries revitalization breakfast at